button to go live. And hello, planet Earth. Welcome to our live stream and thank you for joining us. I'm Lilia of Facialteam, and this is a platform that we're offering to give voice to your concerns. My pronouns are she and hers, and I want to say happy Pronouns Day to everybody who's watching. Let us know, please, if you have any pertinent questions about hair transplant surgery today, as we will be talking about this, and we can incorporate your questions into the conversation. So today's special guest is a dermatologist and hair transplant surgeon who is an expert in hairline feminization and will be talking to us today about the role of simultaneous hair transplants in facial feminization surgery. Welcome, Dr. Teresa Meyer here.
Hi, Lilia. Thank you very much for the invitation. I'm very happy to join this live stream with you and to share what we are doing in Facialteam.
Great. So can you tell us what you're doing today, for example?
Yes, of course. Well, today we are doing a special case. It's a special because it's a patient that she has a Norwood 5. This means that she has a big alopecia, and she performed 2 times FUE, follicular unit extraction, in another clinic. She has not such a good donor, but she's doing a forehead surgery combined with hair transplant. And the goal is to use all her follicular units to add density in the previous hair transplant that she performed. So really it's a bit more complicated case because she had already 2 surgeries before and her density in the donor is not so good. But even so, we can achieve good hair and we will increase her density in her previous hair transplant.
That is great news, Dr. Meyer, and I'm sure she'll be very pleased with that. And thank you for sharing a little bit of information about what's happening today there. It helps people understand how our routines go, and every day is different. So I just like to let our viewers know that Dr. Meyer is not any ordinary hair transplant specialist. So can you give us a little bit more background about your training and what your role is here?
Yes, of course. Well, as you said before, I'm a dermatologist. We dermatologists are specialized not just in the skin, also in the hair. So we are the specialized in hair diseases, not just medical treatment, also performing hair transplant. I did my residency in Malaga, in Spain, at the university hospital. And there I was really very interested in hair, not just the hair diseases. Also, I wanted to know how we can give a solution to all this patient that has alopecia. So I started investigating about hair transplant. This was 10 years ago. Now hair transplant is very famous, but 10 years ago it was not so famous. And I discovered a very prestigious clinic in Brussels with Dr. Bisanga. I contacted him 10 years ago, and there is where I start my, my specialization in hair transplant surgery. Since then, I started doing hair transplant, also looking at patients with combined medical treatment. And well, I started here in Facialteam with this great team 8 years ago. At the beginning it was something different, something new, a combined forehead surgery with hair transplant. But now for us, it's a surgery that with very good success and with patients very high satisfaction.
Fantastic. And I'd just like to ask you also, what particular part of working with Facialteam is your favorite?
Well, my favorite is working here with all the team, because I like working with a team of doctors, maxillofacial surgeons, with also the coordinators. I feel that it's a family, and I can feel that also in the patient. The patient comes here and has her coordinator, the doctors, and it's like every patient becomes part of the family. So I really enjoy coming here. It's not like going to work. It's like to spend the day with the people.
Awesome. Well, I don't want to take up too much of your time because I know you're very busy and you've got to get off and attend to patients. So let's get to the topic. And I'm going to share now our, hang on one second, technical difficulties. Ah, here it is, found it. Okay. We are sharing the screen now. In 1 second. You can see?
No, I cannot see the PowerPoint. I just see your, no, the PowerPoint, no.
No?
I see it like a PDF.
Okay, let me try again. We did just test it a second ago. But for some reason, it's not coming up now.
I see the guion. I don't know how you say it in your
Okay. Okay. So I shared the wrong one.
Yes.
Okay.
Yeah, maybe.
Yep. Okay, let's try again. Let me share the screen. Let's see. That's not the one. For some reason, it's not coming up. So I'm going to open up the other one, okay?
Don't worry, yeah.
The key, yeah, it doesn't want to open. So I'm going to open the PDF and we'll be good to go.
This is live. This happens.
Yes, yes, it is. It is. Okay, now I'm going to share again. There we go. Now we have there. Now, do you see us?
Yes, yes. Now I can see.
Great. Okay, perfect. So, Dr. Meyer, we'll start out by maybe you could give us a definition of what the simultaneous hair transplant is and why the hairline is so important in gender identity.
Okay, simultaneous hair transplant is a surgery where the patients perform forehead surgery and hair transplant in the same procedure. That's a simultaneous hair transplant. And the question about why hairline is so important in facial feminization. Well, I think really that the hairline has a principal role in facial feminization because it's like the frame of the face. So you can have you can perform nose surgery, you can perform jaw surgery, but if you don't have also the frame of your face at the same time done, then really I think like it's like an unfinished painting. You need, it's like a paint that didn't finish. So really for me, not just because I do hair transplant, I think it's really very, very important in facial feminization surgery. That's why we do so many surgeries, because the patients know what the difference, and they can see after consultations what a big difference it makes.
Absolutely. And can you tell us 3 points of the Facialteam process that are key?
Yeah. Well, that picture you can see the team of the hair transplant. We are a team of 3 dermatologists and a team of 5 to 8 nurses, hair transplant technician. It depends on how big is the surgery. And the whole team, we are focused just in one patient. We have an experience of, as I told before, 8 years ago, we started with this technique, and we have an experience of more than 500 hair transplant procedures done with Facialteam.
Wow, that's quite a few procedures.
Yes.
And so the hairline types, and this is very important to talk about.
Well, as you asked me before what I'm doing today, I told you about we had a difficult case because it's a Norwood 5 to 7. As you can see, is the figure type 5. In this case, it's a patient that she really has a big alopecia and she performed before 2 kinds of surgeries. But mainly, I would say that 70% of the patients that come here, they used to have this M shape. It's like the type 2 or type 4, this M shape. And when they perform forehead surgery and simultaneous hair transplant, what we mainly do is we round the temples. And so we get a hairline rounded that makes this frame face feminine. That it's so important because really the recession of the temples is a sign more of a male hairline. That's why hair transplant performed with forehead surgery, really it's so important, because if you just perform forehead, you still will have the same shape, M shape, and then I think you don't harmonize really the final result.
Right, right. So it's quite complicated, and it's interesting to see the percentages in the different hairline types here. Can you give us a little bit more information? I know this is off the the script, but the type 3 is very uncommon, no, among our patients.
Yes, this is very uncommon, and in these cases that there is such a recession, we also need to be sure that it's an androgenetic alopecia, because there is a skin disease called frontal fibrosing alopecia that comes in the same way, but this is an autoimmune disease, and hair transplant, it's not indicated. It's rare to see these cases, but we have had a few here, and that's why it's so important that a dermatologist perform hair transplant, because really just if you are a dermatologist, you can do a correct diagnosis and make the difference between androgenetic alopecia, lichen planopilaris, frontal fibrosing alopecia. So really, that's what we see in consultation. We study good the skin, we evaluate the alopecia, and then we recommend if hair transplant is indicated or not.
Interesting. So in regards to the steps that you were just mentioning, we have the 3 steps of simultaneous hair transplant at Facialteam. Can you tell us a little bit what happens in these 3 steps?
Yes, well, first of all, we usually get a picture of the patient in our email, and they send us the case. And then we see the shape of the hairline, and we recommend a design. Okay, we send them the patient a virtual design of what she can achieve with a simultaneous hair transplant. After that, the patients, we see her in consultation. We see her here, then we ask if she's on medication, if she was treating the hair, because it's also very important to know if there are any medication in the treatment. And then we make a diagnosis of the alopecia, if there is any case of alopecia. We use a dermoscope, and we make a trichoscan, so we can see the density of the hair, we can see the quality of the hair, if the hair is really strong enough for the hair transplant, and then we can see how much hair we can get with simultaneous hair transplant. Knowing that, then we do the design, the patient see the design, and then she knows what we can achieve after the hair transplant. Okay, that's really all the steps mainly that we do before going to surgery.
And regarding this image here, this is not an actual image of a patient, right? This is a simulation. Can you tell us a little bit about how the virtual simulations help?
Yes. Well, I think it really helps a lot, because so you can see more in reality what is going to be the final result. And you can see here what we were talking before, that this patient, she has no alopecia, but what she has is just an M shape, and it's so important to round those temples. That's why with this picture, when you're at home and you see what you can get after the surgery, so really it makes you looking at the importance or the main role of hair transplant. So really, I think once we started with virtual simulation, the patients, once comes here to consultation, they are very relaxed, because they know what they're going to get, And so really, I think it's a first step, very important.
Excellent. So, Dr. Mayer, talking about when the patients come here and they feel comfortable, part of that is the consultation process, right? It's not just one consultation, it can be a process here at Facialteam.
Yes.
So when you're involved in this process, what happens in the consultations regarding SHT?
Well, as you said, it's not a one consultation. If the patient can come here to Marbella, we do so many consultations as she needs, but mainly we do many consultations per Skype because the patient doesn't want to travel, so we do Skype consultations. The main question is, okay, am I candidate to do a hair transplant? And what can I achieve? What is going to be the design? What can I get with this hair transplant, with this simultaneous hair transplant? This is mainly the question. And I will say that 90% of the patients, what they're looking is to round the temples, and they also ask when it's going to start growing my hair, when can I do normal life. But really, the most important is if they can get this round hairline. That's mainly, and then in the consultation and explain what they can get and all that in Skype consultation.
So talking about realistic expectations is one of the questions that comes up. Patients ask about lowering their hairline a lot, no? And how do you attend to that question?
Yes, well, it's so important that the patient needs to understand that this surgery is not just hair transplant, it's also forehead surgery. So there is an amount of hair that we can get when we are combining both techniques. Usually when we are doing a simultaneous hair transplant in a normal candidate, we are talking about 1,800 follicular units, 1,500, 1,800. With that, we can round nicely and with high density the temples. But if the patient also wants to drop the hairline, just dropping 1 centimeter the hairline, it takes maybe 600 follicular units. So sometimes we cannot close the temples and also low the hairline because we need more hair for that, okay? So in cases where the patient needs a lot of hair or needs more than 2,000 follicular units, in those cases, we perform just a hair transplant. We don't perform it combined with forehead surgery because we need more hair.
That's good to know that there are different combinations. It's not always
there are patients patients that they have big alopecia, they perform forehead surgery with simultaneous hair transplant, we get maybe 1,800, and then in a second step, after 1 year, they just perform hair transplant, and then we cover the rest of the alopecia.
So going back to the hairline types, it really depends. That's how our approach is so individualized, right?
Yes, of course.
And apart from the virtual simulations that we've started doing this year, are there any other tools that you would like to comment about that are used in the evaluation process or in the actual surgical process?
Well, as I told you before, mainly when we see the patient once she has the day of the surgery, we do really the good analyze the day of the consultation because we use a special camera where we can see the density and the quality of the hair, and we explain everything to the patient. So really, mainly it's in the personal consultation where we explain everything and the patient can see really her donor area.
Right. I'm going to share now a link in the chat to a video. It's the forehead surgery with simultaneous hair transplants. It's a 3D animated video, and the link is in the chat if anybody wants to check it out afterwards. And there's also information in the description of this video on YouTube, which will remain after we finish our live. So, Dr. Meyer, the postoperative period is a big worry for many patients. So we do have also a video tutorial about how to take care of hair transplants after surgery. And can you tell us a little bit more about some key points that you'd like people to know?
Yes. Well, the most important post-op care, I would say, is the first week. It's really very important because in that week, the patient, she needs to have the hair back. She cannot cover the hair, the temples, for example, with her existing hair. She needs to have the hair back. She cannot touch the hair transplant. She cannot wash normally her hair the first week. Okay, there are some cares that we gave her, like some saline solution she needs to apply and betadine. But usually this first week is very easy because patients are here with us in Marbella and they have many people that take care in the patient. After this first week, the patient can cover the surface in that after 1 week you have just the hair transplant, no crust, nothing, and you can usually do more or less normal life. The only thing you need to take care is, for example, the sun. You can go out, walk in the sun, but for example, being in the beach, the 3 first months, you need to wear like a hat to avoid sunburns in the recipient area. In case you dye your hair, you need to wait at least 1 month, okay? And usually you need to don't do any sports the first 2 weeks. You will feel okay, but we recommend to don't do a sport the 2 first weeks. And usually the hairs that get transplanted, they will fall down, and after 1 month you will see no hair in the skin, no hair, just maybe redness. After 2 or 3 months of the hair transplant, you will see how the hair is growing, and in 6 months you will see how all the surface that was transplanted has hair, but even so, still 50% of the hair needs to grow. That's why we say that the final result is after 1 year. But after 6 months, all patients are really very happy because they see that their hair is here. The only thing is the hair is short. It's like 4 centimeters long after 6 months.
They're like baby hairs.
Yes, like baby hairs. Yeah? But really, those are the post-op cares. After 1 year, you can do normal things with your hair. It's a strong hair. If you want to dye it, if you want to do something, you can do a normal life. It's not a special hair that needs a special treatment after 6 months, or that needs a special shampoo because it's hair transplant after 6 months. So really, it's a strong hair that you can do normal life. Just the first week, it's really very important to take care about that hair. But as I say, almost all patients are here and there is no problem.
Yeah, so what I see comments of patients that are here in the first week, they make comments about not being able to wear a hat in that first
Yes, that's
week.
right.
They use a scarf.
Yes, the first week no hat because the hat can make some pressure, or you can touch the hair transplant, and also you have some edema after the surgery, and the hat after the first week, as I say, nothing you can put in your head.
For people who don't know, edema is swelling, right?
It's swelling, yeah. Edema is swelling, yes.
And another thing that I hear a lot, people, patients saying, "Oh, the hair's falling out," and they get worried, and that's completely normal, like you said. So
yes, that's normal. That's normal. Also, some patients ask us about some shedding. Shedding is if you have hair loss after surgery. This is not frequent, okay? And if you have shedding, you may experience some more hair loss, but not because you had hair transplant, forehead surgery. Even if you have just, for example, no surgery because of the general anesthesia, all people have some hair fall, okay? But it's something that used to start maybe 1 month after surgery, and it stops after 3 months. And this hair that you see, it's falling a bit more, it will grow again. So really, it's not important. Don't worry for that, because it's just because of the stress of the surgery.
Exactly. And I just like to let everybody know I've shared a link to the post-op tutorial that Dr. Mayer recorded some time ago for patients. And if you'd like to have a look at that and see the tips that we have readily available for our patients, in addition to a post-op kit, which all the patients receive. And that includes some products to take care of their hair transplant while they're here, and recommendations for what to use once they're back home. So moving on to research and development, I wanted to mention to everybody that you're a co-writer on one of our scientific publications from 2017. Can you tell us a little bit about what the conclusions were of the study?
Yeah, well, we did this study because really at the beginning it was a technique that there was no experience. We didn't know how it was going to respond the folliculars after the trauma, after forehead surgery, the results, if there is going to be good growth. So what we did is make all the cases of patients that had forehead surgery with hair transplant. We did looking at the growth of the hair, the satisfaction rate, and then we get the conclusion that really a hair transplant combined with forehead surgery is possible. There is no risk for the follicular units. The hair grows with no problem. So that's why it's a surgery that it's completely recommended in those cases of patients that wants to reconstruct the forehead and also wants to feminize the hairline.
Absolutely. Thank you so much for that, Dr. Mayer. And to conclude, I was just wondering if you had any takeaway messages, some final pearl that you would like to share with our viewers and potential patients about simultaneous hair transplants.
Well, I will just say that a hair transplant is very important, but we also emphasize with the patients that it's important that they also take care of their own hair. Many patients need to have also medical treatment for the other hair that they have. So I say, okay, combine hair transplant, but also you need to find the dermatologist where you live that keeps on with your hair, so you can guarantee the long life of your existing hair, even if you are with treatment with hormone. There is indication of doing medical treatment.
Absolutely. And I just like to add to that consultations are free. A lot of people don't realize that, but with a prior appointments, and you are able to have a consultation with our FFS surgeons and our hair transplant surgeons, and doesn't have to be in person. We also do them online. So do you have, just to close on a lighter note, Dr. Mayer, do you have any recommendation for our patients of something special to do on the Costa del Sol?
Well, enjoy the sun. That's why it's called the Costa del Sol, because it's so sunny. We're just almost in November and we have 25 degrees today. So I think just come and enjoy the weather, the people, and the food. That's really very good.
Exactly. Very good advice. Well, thank you so much, Dr. Mayer, for taking time out today and to share this. We did it last month in Espanol, el mes pasado, and today in English, so that we cover the basis of information that our patients need. And I just want to say, again, thank you. Give us some claps if you like this in the comments. If you're watching this in the recorded version, please leave us some comments. Follow our channel, share this video with your lovely friends, and don't forget, tomorrow is Spirit Day. Today's Pronouns Day, International Pronouns Day, and tomorrow is Spirit Day. So we just want to take that little time to join our voices against bullying of LGBT youth. So show your support however you can. Stay tuned for next month. We're going to have VM Maynard again here, speaking with a parent, and also a special live with our rhinoplasty specialist, Dr. Rayinga, who will talk about nose feminization. So please stay tuned, and thank you so much again. And we will be back soon.
Adios. Adios.
Your health and happiness matter. Bye.
Adios.